By filing your personal income tax return, you may be eligible for one or more of the following programs, where your income will determine the amount paid to you. Even if you have no income and you are over 18 years of age, it is important to file your tax return so that you can get payments under these particular programs. The first being the Goods and Service Tax Program, the second, the Climate Action Incentive Program, and the third one, the Canada Child Benefit Program. The Canada Child Benefit Program, of course, if you have children, will reflect payments to you. Otherwise, no payment comes to you. These programs have also corresponding programs in the various provinces and territories. So by applying to the federal, you'll also get the corresponding payment from your provincial or territory if they participate. To help you reduce your amount of tax paid, you should collect the following receipts. If you have any tuition or education fees that you're paying to improve your working skills, if you're going to university or college on a permanent or part-time basis, if you have child care expenses, and if you have medical expenses. By collecting these receipts, you can possibly reduce your income that is taxable. Let's look at some common medical expenses for people that have diabetes. First of all, if you're claiming medical expenses, you can claim medical expenses for any 12-month period. As an example, if you the reporting tax year is 2020 and you've incurred medical expenses, let's say from July of 2019 until June of 2020, you can claim all those expenses in the 2020 tax year. So you select the 12-month period that is most beneficial for you, that has had the greatest medical expenses. Of course, you only can claim them one tax time. The next point I'd like to introduce is that if you are incurring and participating in an employer health plan, and let's say it's a co-share plan, so your employer pays for part of your health care cost and you pay for the other part. Two examples. One, let's take blood glucose strips. I go purchase my blood glucose strips and they cost me $100. My health plan at work, when I submit my expense, will reimburse me. Let's say they reimburse you for $80. That $20 difference, the $100 minus the $80, is a medical expense. Another example would be where your employer says, we will cover for your health cost, we will pay for the health premiums, but we only pay for the health premiums for the first $1,000. And the health premium cost, let's say, is $2,000 annually. The $1,000 difference, $2,000 minus $1,000 for health premiums, that $1,000 cost difference is a medical expense. Most often that's seen on your payroll check, on your pay stub, as a deduction for health cost. All prescriptions prescribed by a medical practitioner are deductible. The definition for medical practitioner differs from province and territory. It is important to check if the medical practitioner in your province or territory is one that you're allowed to claim the medical expense. As an example, dietitians. Dietitian fees that are paid in all provinces are a deductible medical expense. But if you incur a dietitian fee in a territory, then that fee is not a medical expense. Travel costs. To visit a defined medical practitioner where the travel exceeds 40 kilometers one way is a deductible expense. And if you have to go 80 kilometers to go see a medical practitioner, then you also get not only the travel costs, but also the meal related to it and the parking related to that expense. There is an extensive medical guide, RC 4065, that you can search on the Revenue Canada website or by doing a Google search for RC4065. It often comes up and it'll provide you a detailed listing of all medical expenses. For seniors, in addition to the goods and service tax credit, the climate action incentive, the medical expense credit, the disability tax credit, and the enhanced drug benefit programs for seniors over 65, you can reduce the amount of income tax paid by considering the following two programs. Splitting up to 50% of your eligible pension income from your registered retirement income fund or your defined benefit pension plan with your spouse or common law partner. This is done when you're completing your annual tax return. Spouses and common law partners may split their Canada Pension Plan payment up to 50% of the amount, provided that both are over 65 years of age, by placing an application with Service Canada. So this is done prior to receiving your CPP if you wait until age 65, or it can be done at any time after age 65, provided both partners are over 65. And the amount can also be changed subsequently in subsequent years. The third program is that by completing your income tax return, Service Canada will assess the return and determine if your income is low. So for low-income seniors, a guaranteed income supplement is provided. The guaranteed income supplement is reviewed by Service Canada after completing the tax return in the month of July. Notices are mailed out in July to all low-income seniors, advising of their eligibility. If you are eligible, then the amount is paid with your old age payment on a monthly basis. The amount of guaranteed income supplement can be also increased by the amount that the provinces and territories pay, and the full amount of guaranteed supplement, not the old age portion, but the guaranteed supplement, is non-taxable.
Losing a job is tough, but it doesn't necessarily mean you lose your supplementary health benefits. If you've been laid off temporarily, check with your employer's HR department to see if your supplementary health benefits continue while you're waiting to be called back. If they don't, check with the insurer that provides your workplace plan. You might be able to convert your group health benefits into a private health insurance plan. But if your group benefits plan doesn't have this provision, you can still apply for individual health insurance. You can contact any health insurer that provides this type of insurance.